Hey guys, welcome back. You are listening to the Ancient Health Podcast. My name is Courtney, and today our guest hails from Charleston, South Carolina. So he is a friend and an expert in the field of peptides and so much more. But I'm thrilled to be bringing on Dr. Craig Koniver because he is really a leader in the space of really like alternatives that are progressive in the natural health space. And we're going to focus on peptides today, but he's the founder of Koniver Wellness. We're going to link everything in the show notes for you so you guys can access so many of his resources. But he's in the space of performance medicine. So if you're somebody that really likes to up the ante in your life, he's the person to go to. He's worked with so many different professional athletes and people that really take their health seriously. So Dr. Koniver, welcome to the show. Thank you for spending some time with us today. I know our audience is going to love this conversation.
Awesome. Well, thank you for having me, Courtney. Yeah, I'm super glad to be here and have the conversation and be able to talk about all these awesome topics.
Yeah. I mean, guys, I have to tell you, I probably haven't learned as much as I have from him and his resources. And I've actually been to his clinic. I've been here, met him in person, and we've worked together for several months, actually starting probably like late spring, early summer. And I can tell you, after having my third baby at the age of 38, I mean, I really struggled for about a year. And it wasn't until we really started to dial some things in and bring in some things like peptides. Within a very short few months, I noticed tremendous results. And this was like a whole new world to me. And I kind of talked a little bit about it on social media. So I've just been chomping at the bit, like so ready to have this conversation because I know our listeners are going to find so much value in this. I want to start out, and just dive right into the world of peptides because that's really a conversation that I feel like not many people are experts in. There's maybe some voices and you'll hear some different, bodybuilders and gym people and stuff like that. But, I don't know, to me, like they're using it for one single purpose. And you're really teaching and instructing practitioners and providers all over the world how to effectively use this to help people. So can you explain what peptides are just to give us a good baseline and kind of a foundation?
Yeah, I mean, that's a great starting point. So peptides are all naturally occurring molecules, so chains of amino acids that are put together in novel combinations with different purposes. So when we got started with peptides, which is probably 6 or 7 years ago, it actually was with the competitive CrossFit community. And that community looking for an edge, but tired of the harsh effects of things like anabolic steroids. And they were looking for other ways to improve their performance and certainly their recovery. And so at the time, we were using what we called the fitness peptides, which were the growth hormone releasing peptides. And it started with names like sermorelin. And then we've kind of advanced that to things such as ipamorelin and GHRP6, GHRP2, hexarelin, tesamorelin, all different kind of varieties of molecules, again, just chains of amino acids. So to be technical from a biochemistry standpoint, we call it a peptide if it's 40 amino acids put together or less. We call it a protein if it's 41 amino acids or more. And so by definition, these are small molecules. And so just inherently, because of their size and the way they work, they're so safe. And that was the first thing for us using them is we want to make sure that different tools are safe for people who are using them. And that's what we found off the bat with peptides is even to this day, where we're using so many more peptides than just the fitness or growth hormone releasing peptides, we rarely ever see any negative side effects. And so that's amazing for people because that's always the biggest hurdle. And so, in very simple form, most of these peptides are injected under the skin. So they don't have great absorption through the gut, but they do have great absorption through the skin and kind of getting into the bloodstream that way. So most of them are used either once or twice a day. And then we like to use a schedule of, injecting Monday through Friday, taking the weekends off, which is really mirrored after using human growth hormone or HGH. And so, to answer your question, peptides are chains of amino acids. It started very limited with growth hormone releasing peptides. Now, 6-7 years later, it's blossomed into peptides for inflammation, for your immune system, for your nervous system, for your mitochondria, for your skin, for regeneration, for wound healing, you name it. There are so many peptides we can utilize.
Yeah, it's incredible. And correct me if I'm wrong, but the way that peptides work, like a very simplified maybe mechanism of action is that they are signaling molecules. So they're telling your cells what to do. And they even have, and maybe this is more bioregulator focused, and those are the shorter chain amino acids, like is it 2 to 4, I believe?
Correct.
Yeah. And so, and those can actually signal genes to turn on or to down regulate. Is that right?
I think to some extent. I mean, again, I'm a clinician, so I'm interested in clinical results. And I think what you're saying is spot on, right? There is the biochemistry that seems to be about how these molecules can signal, other molecules to work, or in very simple terms, because I think a lot of people understand this better. For example, if we talk about hormones, right? And so if we're talking about growth hormone, and growth hormone is an anabolic hormone secreted by the posterior pituitary part of your brain. And we think, this is tying in why we think it's important for people to be asleep by 10 p.m. because you get the maximum pulse of growth hormone after between, say, 10 p.m. and 2 a.m. Well, growth hormone then travels to your liver. You make this substance called insulin-like growth factor 1, which then travels throughout your bloodstream. It binds to the cells and tissues and muscles and has an anabolic effect, meaning recovery, mending, rejuvenation of those tissues and cells. And so if we look at peptides from that frame of reference, the growth hormone releasing peptides are helping you push out more of that growth hormone. So they're kind of a push, which for, again, from a safety perspective, one of the troubles with HGH, while it's an amazing substance, our experience is a lot of people abuse it, right? And they get into trouble with it because they say if a little growth hormone is good, a lot must be better. And we see this with young athletes who are 18, 19, 20, particularly, high octane type athletes who start using HGH. They're invincible, literally, and they don't want to stop. So they can do a really intense workout, wake up the next morning and do it again and keep doing that. But the trouble is they kind of manipulate that hormone system. The nice thing about peptides, even though they're signaling molecules like hormones, you're not going to wear out that signaling system. So there's like a fail stop in there.
Yeah. And that is because I think that some people too would probably, if they're just starting to wrap their head around like, okay, maybe this is something that could benefit me. I think people may get confused with the difference between something like a drug and then something like a peptide, where there are lots of side effects with drugs. There's a lot of interference. There's a lot of there are issues with feedback mechanisms, right? If you're taking something and then you're saturating receptor sites and you're wearing them out. So yeah, I like that you're really hitting on the point with peptides, is that it is different. I think our perspective, because of where pharma is, especially when we're looking at something like an injectable, we just think, well, this is like a drug on steroids, and it's not. Sure.
I agree. And I think that's a really good point, is pharmaceuticals by and large come with a host, right? They're big molecules. They do a host of things. A lot of times those hosts of things can be negative for people, right? And so it's with every pharmaceutical, it's balancing the benefits with, the negative side effects. Which really, again, I'm not saying peptides are perfect, but by and large, we don't ever see any negative side effect. The biggest one is this one called tesamorelin, which is used kind of as a fat loss peptide because it helps, burn or, helps people lose visceral fat around the organs. And sometimes, probably 30% of people, if they do an injection, they'll get an itchy red rash right at the site of the injection. We think it's a histamine response, but it's self-limited, will go away, doesn't accelerate to anaphylaxis. So safe. So most people are okay with that. Some people get irritated by it. They don't want to use it, but for most people, it's fine. By and large, that is the side effect for peptides. It's really amazing.
I can tell you personally, after doing some of your peptide protocols for a number of months, and we kind of switched some of them up too. I didn't have any down, there was nothing. I only saw benefit. And like I said, one of the things that's beautiful about peptides, and I love that you do this, is that you can combine different peptides in different peptide combinations. So I would love for just to get your thoughts on, what you're seeing clinically for people. If somebody's listening and they're like, okay, maybe I want to optimize my body composition. What are the peptides that you feel like, assuming, and maybe we even start with this first, because, in the world of semaglutide and tirzepatide and, some of these other GLP-1 agonists, people are just like, all right, peptides, I could lose weight because it's going to crush my appetite. And then, but I think there's something to be said in making sure that you're handling the foundations of your health, that you're not just living a terrible lifestyle and then just spending a lot of money on peptides to try and, make up a lot of ground. So where is it that you start with somebody, I guess, to make sure that they're set up for success with peptides? And then let's go into maybe some of the clinical applications, because like you said, it goes so far beyond just your aesthetic. Like that, obviously, when you start optimizing function, like your body starts to look better, but like your sleep, I was sleeping better than I ever have. So anyway, that was like 12 questions packed into one.
That's good. But you bring up some good points. So just to give you a little background history, the way I started using peptides again was I'm going to use one at a time. I'm going to learn from it and see kind of the flavor of it, how it works, how it feels. And then what I realized is that we can synergize peptides together, right? So instead of just doing like I said, there's peptides for fitness, there's peptides for inflammation, there's peptides for immune system, on and on and on. So just like we do with nutritional supplements and we stack them, the same can be done with peptides. And so what we learn from our patients is, okay, we're going to have the best results when you're using, say, 3 peptides or 5 peptides together. The trouble is, from a compliance standpoint, no one's going to be injecting 3 to 5 or more peptides at a time once or twice a day, right? It gets very tedious. They're not going to see, even though we're using very small insulin needles and it's right under the skin, doesn't really hurt. It's just a pain. And so we worked with different labs and have one now that we work with, who then found a way to combine them, together. So, from a solution standpoint, it's all mixed together. The pH is tested. It's all tested for potency, sterility, all of that. And so it's something that kind of out of the box can be used and used safely without having to use multiple things at one time, which again, people are going to get tired of, you know what I mean? And so that's kind of the origin, how we kind of got to this point where I created these different combinations, and they're not perfect, but by and large, they work really well. And so there's synergy. So for example, we use a lot of the growth hormone releasing peptide, ipamorelin, but we also, when we use that, we combine it with one called BPC, which stands for body protection compound. And body protection compound kind of grew up as a anti-inflammatory peptide. But what's also really cool about BPC is that upregulates growth hormone receptors. So now if you're using a peptide like ipamorelin or even tesamorelin, where you're putting out a little bit more growth hormone, now you're going to upregulate the other side of the equation, which is the receptors. So you're going to get much more efficiency. And so that's how we can kind of use the science to guide how that works. And that's why it's just an efficiency thing. And I think, to touch on this, because I think it's important, even with a lot of the functional medicine doctors and the integrative doctors, the model is the same as like, okay, we're going to do a bunch of lab testing, and then you're going to take these compounds in the background, like vitamin D and your fish oils and all these vitamins. But a lot of people don't feel that, right? It doesn't change how they feel. Peptides are the more modern way to get people feeling different. And that's important because what I think was, when people are injecting themselves, they're going to take more seriously the other aspects of their life to be healthy and fit, right? Like if you're injecting something in your body every day, you're probably going to pay more attention to the food you're eating or not eating. You're going to pay more attention to good sleep habits. You're going to pay more attention to fitness and working out. And so by and large, over time, if you're using a peptide to help you lose weight, you're also going to pay more attention to all the other things that we like to talk about, which are certainly the foundation, right? But the reality is, not to be cynical, but in our society as Americans, the average American, overweight, tired, depressed, and at this point taking 4 or more pharmaceuticals. It's massive, right? And people know that like nutrition affects how they feel, affects how they look. But are people doing anything about it? Most people aren't. Most people are going to be like, I'm just going to take my medicine. Yeah. Peptides, I think, are game changers in that, because of the simple act that you're putting a needle into your skin. You know what I mean?
Yeah.
So it's really good that way.
I've never heard anybody say that, and it makes so much sense. And you are spot on, because I feel that way. I'm like, it was like a commitment, and I'm like, okay, I'm not messing this up. Like, I'm not drinking alcohol. I'm actually going to go to bed on time. Like, because I knew, I was like, okay, I'm trying to optimize sleep. Like, I'm trying to recover better. So if I'm staying up late or, looking at my phone or having, all the lights on, like just something that stimulates, like why would I, it just doesn't make sense why I wouldn't be pairing or putting more intentional effort. And like, I've never actually like thought of it that way, but it's 100% accurate. So it's a great point.
Yeah. And then it leads into, because I don't think peptides are meant to be forever, right? Like one of the troubles with pharmaceuticals, if we're talking about them, is most of them, in my opinion, can be tools, but they're not meant forever. Unfortunately, the way pharmaceuticals are taught and the way most doctors prescribe them is they become forever, right? And so the best example is we look at the proton pump inhibitor omeprazole or Prilosec, which was only supposed to be to help people with, having just GERD, reflux, things related to having some, upset in their GI tract. The goal with that was 6 weeks, right? Well, that's been blown out. People who start Prilosec or those types of medicine, protonics, they're on them forever. And people say, well, that's not a big deal. It's helping with their symptoms. Yeah, but it's also causing immune problems, right? We know that you get more pneumonia. It helps decrease the amount of nutrients you can absorb. So you're at risk for things like decreased bone density, malabsorption of nutrients, a whole host of things. So that's a major problem. So I don't think that pharmaceuticals are designed forever, and I don't think peptides need to be forever, right? I think you want to work on a goal. And what's nice about peptides, because the most common question I get is, okay, if I stop the peptides, am I going to then revert back? And I don't think so, because you've now changed your kind of mindset and how you approach your own health, right? And how you view yourself. You spent time injecting yourself literally every day, or again, 5 days a week or whatever. You're going to, if it clicks, you're going to make changes in that mindset, which is then going to lead to you kind of raising your hand, which is the key part, right? Like people signing up, raising their hand and saying, I want to better myself, right? Because everyone knows the right information per se. Like people are smart. They just don't want to do it. And so this is the kind of gateway to changing that mindset so they can, want to do it for themselves.
Yep, absolutely. And I imagine when people do start to feel good, they get worried, like, this has got to be the new standard. And if I stop, then I'm not going to reap the benefit. But peptides, like you said, are helping restore function and improving the baseline of your efficiency. So that was one thing that I noticed. And one thing that I've learned just in following a lot of your research and a lot of your resources, the best way to use them is to cycle them. So do them for a short period of time, really dial in some things, improve. I mean, your body composition improves, your sleep improves. Now you step off of them a little bit, but now your body is now in a different place than it was before you started, which means that you've got more effective capacity. So I think really trying to help people recover is such an important part, because people are just, there's so much stress that people just can't recover, it seems like. So as far as like how people get started, or what it is that you feel like, what's like, in your opinion and clinical experience, if somebody is interested in getting started in peptides and they're like, I've got a lot of metabolic insufficiencies, I'm tired, I'm brain fogged, I'm carrying extra weight. Where do people start? Because there are so many different peptide combinations. Like, how would you point them in the right direction?
Yeah. So the way we do it is we have a consultation, right? Because we want to be able to advise people. So there's a couple ways. If people are working with providers like us, it's going to be more formal, right? We want people to have the guidance. We want to make it a relationship and build upon that. And then there's people who are going to kind of just do it on their own. Either way, what I think works best is when people figure out what is holding them back, right? That's the question we want to ask. Like, what is the number one thing holding you back from being your best self? Some people will say it's sleep. Some people will say it's weight, focus, whatever, athletic performance, strength. I don't know. There's a variety of things. And so that's where we get started. And that's how we've created these protocols, is what are you looking, your biggest goal, your biggest challenge? Because what's really interesting about peptides, even though we have peptides for fat loss or peptides for strength or peptides for focus or peptides for sleep, there's a top-down effect, a rejuvenating effect that you're going to hit on everything. And so you don't have to worry about, you're going to be boxed into a corner like this is the only thing peptides are going to do. That's what's so good about them, is it's multifactorial. And then to touch upon your point about, cycling them, we like to build cycles in. People are using it Monday through Friday. We like people to do it 3 months straight and then pause, kind of say, where am I in this? Now, it could mean that you say, I really like this, let's keep going. Or you could say, I'm sick of injecting myself, or I've reached my goal and I want to pause, or I want to work on something else. Again, because peptides for most people, my philosophy is if you're injecting something into your body, you probably should be seeing results certainly by 4 weeks, if not 6 weeks. And if you're not, it's either you need a little bit longer or it's probably the wrong mix for you, right? And I want to touch upon, because a lot of people ask, particularly people doing peptides on their own, do I need to do lab work, to kind of qualify? Because peptides are so safe, there's some contraindications. Like we don't use peptides with people with active cancer. We don't use peptides in pregnant women. There are some contraindications that we want to steer clear from. But lab work's not one of them, because there's no real lab that I could do that says someone is going to qualify or disqualify, right? So while we certainly want to do lab work and monitor people, it's not going to rule them in or out, if that makes sense. So if you're, to kind of get more to, if you're doing peptides on your own, it's pretty well laid out. Okay, this is my goal. Here's peptides that are going to help. If you're seeing us, we're going to help guide you in that process, because we want to be, develop that relationship and go from there.
Yeah, I would say absolutely, unequivocally, if you do not know the first thing about peptides, maybe this is the first conversation you've heard about it, do not go Wild West and try and just, order stuff and then you're trying to reconstitute and you don't know what you're doing and you're watching, this, you probably can't even find it on YouTube, because it probably is like, I don't know, like it's just, they're safe. But again, like, I think it can be overwhelming if you don't know, because there's a lot of peptides. There's probably a lot on the market, and maybe even talk about that too, because people are going to wonder like, okay, well, is this something I can just go order off the internet? I can just Google myself and figure out.
It's a great question. So you can, right? So there are research companies that you can go, if you just go into Google and type in peptides, they'll come up. You can go select your peptides and purchase. They're going to say research only, not for human consumption. Or the other way of doing it would to be, and I'm not the only one, but work with us or lots of practices like us who are going to, again, build that relationship and kind of see where you fit, and then be able to give you better recommendations for that. And then it's a good time to bring up, it's a really gray area with the FDA. And a couple months ago, we got word that the FDA had removed, like kind of banned, many of the tried and true peptides. And it's very kind of confusing, because these tried and true peptides are very, very safe. Again, we've used them for years and years and years. We don't see side effects. Again, super rare. And so it was a big setback for kind of the people we work with and kind of everyone who's into peptides, because now what the FDA said specifically is compounding pharmacists will not be allowed to utilize or compound certain peptides. Now, there may be a reversal of that. That's what it seems like. I still think it's a gray area, but it's a confusing time. And so it taps into this question of like, what is a peptide in terms of how does conventional medicine see it? And it's still going to be a gray area. It's not FDA approved, right? It hasn't gone through the drug approval process, but it's kind of like a supplement, a natural product that's kind of grandfathered in, so to speak. But it's still gray. But again, it's very safe. And so it's a little confusing for everyone involved. You know what I mean? Because people, it overlaps. Like, what do we do with that information? Who has authority over that information? Again, we want to try to stay ahead of that from a compliance and regulatory standpoint. And we're trying to do our best. Unfortunately, a lot of the government agencies aren't able to answer those questions specifically. So don't want to scare people, but I do want people to be informed. Like, this is a gray area, certainly safe. And, to me, I want people to have access to things as long as it's safe, as long as, you have someone to help guide you and to be there in case something goes sideways. That's the best way to do it. To your point, very hard for people to kind of get this stuff, reconstitute it, know how to dose it, how to inject it. It's hard for people.
Yeah. It opens up a whole other conversation. We won't go down the rabbit hole, but, they're not FDA approved, but peptides have been around for a very long time. Like the Russians were the ones that started using it, back in like the 1940s or something, Cavinson. I mean, there's been a lot of research. They've been used for a long period of time. But big pharma is, clearly has a heavy interest in things that are going to make people better, make people well without virtually many or any side effects if they can't monetize off of it. And so I
Totally.
think that it's being kept from people, and it's being kept from physicians like you that are trying to access them for their patients. So, just putting some context out there for you guys, you're kind of like, oh, well, it's not FDA approved. Well, the FDA is, their bottom line is to make money. So and they're a governing body that, my personal opinion, you could probably read between the lines on it. But that being said, when you really start to look and dig into the history of peptides, how they've been used and how people are effectively seeing so many changes, I mean, the proof is in the pudding. Like, you just can't deny it.
Well, and to take it a step further, you brought up, which is a great point, semaglutide, Ozempic, and tirzepatide, Mounjaro. Those are technically peptides. And what has happened over the last 2 years is they have become the number one selling drugs in America. The profit has been incredible for the pharmaceutical companies. So I would imagine if you're a pharmaceutical company and you see that peptides work, they're safe, and you can garnish big profits from it, it would make sense then that you would want other peptides removed from circulation. So then at some point you could come back and patent those, right? So that you can make big money. And to be clear, so people can really understand what how deep this goes, Ozempic or semaglutide and Mounjaro, tirzepatide were never patented. What was patented was the delivery process or the pen to deliver those medicines. So they were FDA approved initially for type 2 diabetics, and now they're getting approved. Tirzepatide's been approved. There's a brand name of tirzepatide, which has been FDA approved for weight loss. And so if that makes people feel better about using them, great. But I'm like you in terms of the role of the FDA doesn't always line up with access and what's best for people, wanting to better themselves, right? If we look at pharmaceuticals and their role, they have a time and place, but it's mostly in this kind of life-saving realm, right? Like if something really bad happens to you, let's take advantage of modern medicine, right? But if you want to be really well, that's usually not involving drugs, right? And I know that, and we all know that, because if you look statistically and epidemiologically, we're not making a dent in cancer. We have more autoimmune disease than ever before. We have a generation of people taking cholesterol-lowering medicine, yet we're really not making an impact there, right? Neurodegenerative disease is taking off, things like dementia, MS, ALS, Parkinson's, these big, scary things. We have more depression, anxiety than ever before. So when people come back and say, well, no, it has to be FDA approved because the pharmaceutical companies are the only people, I would just question that, right? And again, people need to make their own decision, but they need to make it using informed consent. And the problem is that most people don't realize is if you have a regulatory body like the FDA removing things, you can't even talk about them, right? We don't have the opportunity again. So that, to me, I would hope shed some light for people to be like, well, let me question that aspect. Because ultimately, if we want to be our best, why not have discussions and work it out, test it out, and let people figure it out, honestly.
Yeah. I mean, I think it's just criminal, honestly, what we're doing to people with drugs anyway, getting them essentially just in a cycle of sick care. And, it's just, okay, well, we're just going to Band-Aid one thing with another. And then, people, like you said, are on 4 or more medications and they're young people now. Like
it's crazy.
Like, it really is. And I'm like you said, cancer, autoimmunity. I mean, we're just seeing children now with, what they're classifying as behavioral issues and things like that. But I mean, it's just what these kids. What's that?
I said it's insane. I would tell your listeners, if they're not familiar with it, go Google the Flexner Report, Flexner, which was came out in 1910 and was funded by the Rockefeller family. And that report changed the entire landscape of health and medicine as we see it today. And what that report did was it said that medical education had to be focused on pharmaceuticals, and it did away with naturopathic medicine, osteopathy, chiropractic, acupuncture, nutrition, botanical herbs. All of that were seen as essentially voodoo and not mattering, and they couldn't be supported by education. So all of those schools went away for a period of time, and now it promoted vaccines and pharmaceuticals as the only way to be healthy. So, a lot happened at the end of the 19th century into the earlier 20th century. That's a big deal. And so your listeners should go look at that, because that's changed how we see ourselves. We became a very cause and effect, like very linear, right? And this is, I lived it. Medical education is all about the pharmaceutical industry, right? It's a patient comes in and complains, and you're thinking, well, they need this drug or that drug or these 3 drugs. And then they come back and say, I'm not feeling better. Well, let me try 3 more. And like I said, as a society, just stating the facts, more than 50% of us are overweight, tired, depressed, and now on 4 medicines. How is that working for people?
Yeah, such a good point. I'll link that in the show notes for you guys. Flexner Report. You really start to see things through a different lens. That's for sure. When you can actually see the history, because it's all there. I mean, it's just that we're being sold. I mean, we're the only country, I think, that like markets drugs like on television, commercials. Like, it's just unbelievable that the drug companies are going after people in such a marketing way that is so misleading. But here we are, and I think that this is such an important conversation to be had, because again, like somebody like yourself that's an expert in using a tool, these things like peptides, can't even really openly speak about it. It's like, you can, but it's a very like interesting time that we're in with peptides, because the FDA is kind of jerking them around a little bit in terms of regulations of what you're even able to do with them. So it is a very revealing time for sure.
No, it's a great point. I mean, yeah, you have to be, it's just like we saw with the vaccine and everything. You have to be careful what you say, because there's powers that be want to censor and limit information, right? And it doesn't have to go far as taking a vaccine. And again, my stance on that is I want people to choose what's best for them, right? Like have all the options available, but then educate people and inform them and let them decide what's best for them, right? And when you are unilaterally taking things off the table or mandating things, how does that give people choice and the freedom to choose for themselves, right? And that's what it comes down to. So if you want to be your best, you're handicapped, you're handcuffed, and you can't, because you don't have the forum to even talk about these things, right? And as doctors like myself and people, health experts like you just have to be careful what you say, because the powers that be are very powerful, and they don't want, real information getting out there. And it's happening at a faster rate, for sure. Yeah. Well, I'm glad we're having this conversation, and I hope that, I know this is going to be so valuable for you guys listening. And I want to ask, we'll kind of like rapid fire some of this, because I'd love to give people some ideas, or at least maybe some examples of what you're seeing really work, because that's what people love to know. They want to hear the stories about what's working for other people that may actually work for them too. So when it comes to sleep, I see this all the time, especially for a lot of women, a lot of moms. Like, I mean, they're running hard all day long and their recovery is terrible. Like they just can't either fall asleep or they're waking up. Are there peptides that you like, or peptide, combinations that you feel like really help women, or, I mean, it could be men. We're not gonna leave the men out of the conversation. But what are your best sleep and recovery peptides? Yeah. So when it comes to sleep, I think it's a great question. And like most of us don't sleep as optimally as we can, for sure. It's a stressful time, and it's hard to get high quality sleep on a consistent basis. So most people I work with, pretty much everyone I know, myself included, it's very challenging to have great sleep 7 nights a week. So there are some really key peptides that help. First is epitalin. Epitalin was one of these Russian peptides that you were talking about. It's been used extensively for decades, and it was thought of as this very powerful antioxidant, kind of longevity peptide. But really, I think where it shines better is if we use smaller dosages, because of its effect on the circadian rhythm. So we like people to do it at bedtime. A dosage, for example, could be something like 500 micrograms to 1,000 micrograms at bedtime. That can make a nice impact on regulating that circadian rhythm. And you could combine that with something like pinealon. Pinealon works on the pineal gland, is where we release melatonin. Most people are familiar with melatonin at this point, which is kind of the hormone that's secreted when light changes, when it starts becoming dark, which helps us feel relaxed and helps us sleep better. It's a strong antioxidant. Those two together work great. If you combine them with a growth hormone releasing peptide like ipamorelin or even GHRP6 or GHRP2, again, growth hormone has a really nice kind of not sedating quality, but helps you get quality sleep. And then on the recovery side, it all works together, because if you're sleeping better, more quality sleep, you're going to wake up feeling refreshed, and then you're going to be able to do more and recover faster, right? And so there's this push and pull. We are catabolic during the day, meaning wear and tear. We're driven by the hormone cortisol, things like, cortisol, insulin. And then at nighttime, we are anabolic, or should be anabolic. Things like growth hormone, testosterone, melatonin, DHEA should kind of shine through. And it's that push and pull. We know as people get older, we tend to be more catabolic, less anabolic. And that's in large part to having, interfering with cortisol, but it bleeds over to growth hormone, testosterone, and melatonin. So we kind of hit that button so we don't get those hormones released as much. So, to keep it simple, epitalon, pineolon, something like ipamorelin, those three together work great for sleep.
Yeah, that's great. What do you think about someone that is, maybe wanting to improve their cognitive ability or cognitive function? So maybe they're just like, I want to feel sharp, and maybe we can talk about delivery too, because I know that there's some cognitive ones that maybe are best used as a nasal spray. But what would you say? Because and I think like we said in the very beginning, like, guys, there's so many peptides, and they can work on so many different pathways. So it's not just, like putting on muscle,
Right.
which, could be great, but there are things that help improve your brain function and help you think clearer and sharper. So what would you say from more of a cognitive space have you seen work really well?
Yeah. So I really like the peptide CMAX, SEMAX. And CMAX is another one of these Russian peptides, still pretty widely used in Russia for people after they've had a stroke or a traumatic brain injury, a concussion. And so CMAX seems to increase BDNF levels. BDNF, brain-derived neurotropic factor, is kind of the juice the nervous system or the neurons live in. And so that works really well. If you combine that with another Russian peptide called Selank, and Selank is SELANK, it's a chemical cousin of CMAX. And what Selank does is it taps into the GABA system. So particularly for women, who tend to be ruminating more in their thoughts, particularly for sleep, but also cognitive functions tied in. If you do Selank, you'll feel a little bit more calm, centered, and grounded. Helps you sleep better, but also helps you relax, which is going to also help that cognitive function. To your point, I like nasal sprays because you can use the nasal spray that has peptides in it to hit the nervous system quickly. So the plus side of nasal sprays for peptides is it gets into your system really quickly. The downside is it won't stay in your system very long. Right. And so nasal sprays that have CMAX, Selank, other peptides, you can use them throughout the day, like multiple times a day. Whereas if you're injecting it, most of them are going to hang around a little bit longer due to the pharmacokinetics, and you could do a once a day injection, right? Or you could stack them together because it's so safe. You could do an injection in the background, and then you could do a nasal spray of something like CMAX, Selank, something like that. So that's really good. We also use don't use it as much, but there's two other peptides, cerebrolysin. Cerebrolysin has a long history of helping people after a stroke. It helps the nervous system communicate better. And then dihexa, DIHEXA. A lot of people use it topically, but you can use it orally. It's one of the peptides that's actually absorbed orally, has a really long half-life. And they say, as far as I know, of all the substances on the earth, it increases those BDNF levels more so than anything. And so that's an interesting compound too. So those are just different ideas.
Okay. Yeah. I've started looking into cerebrolysin. Is it like porcine? Is it like what?
Yeah, it's like a neuropeptide that's made from pigs. You're exactly right.
Okay.
Absolutely.
That was what I was reading about it. I haven't dabbled with that one yet, but I can tell you I've used Selank and CMAX, and I've also gotten that from you guys in the form of a nasal spray. I've done it in the injections too, but those are great. And it is really nice to have the nasal spray because, like you said, the half-life, it's definitely the effect is not as long. However, it's like immediate. So if, when you're in your kitchen and it's 5:00 and kids are throwing themselves on the floor crying and you're like trying to make dinner, and I'm just like, wow, and I'm like, I don't want to have alcohol because I know that's a neurotoxin. So like, how am I just gonna take the edge off here? But I actually do feel like I'm not gonna go to sleep, but I just kind of, I don't know, it kind of calms me down. So If anybody relates to that, that's a solid combo.
It is. No, you're right. No, it really works. Again, these things aren't perfect. There's no silver bullet. But again, tapping back into the safety process, so safe, so safe. And for most people, they work really well and really quickly. So they're great for people to try.
So good. Okay, well, we have to talk about immunity because there are so many people right now. We're recording this in January and it is like unbelievable. My oldest daughter had to be picked up from school early today. Like half her class is out sick. So colds are just running rampant and viruses and everything else. And so there's a lot of people that are really concerned about their immune health and maybe even supporting themselves, post-infection. And they just kind of feel like those symptoms are lingering. What peptides have you seen that have been effective for helping somebody either recover their gut if they're just inflamed and maybe they've got leaky gut or they're just maybe they do have like a virus that's just they can't quite seem to get over the hump? Are there peptides that help support the immune system so that they can really start to clear this stuff out and feel better?
Yeah, I think the question is really timely. So the best immune modulating peptide is something called thymosin alpha 1. So THYMOSIN -alpha-1. And that hands down to me is the best immune modulating peptide. So what's really neat about it is if you have an overactive immune system, right? Someone with autoimmune disease or allergies, you can use thymosin alpha 1 and it kind of tempers the immune response. And the same thing is if you have an immune system that's underactive. So someone who's getting a lot of viral infections, someone who just gets sick a lot, it'll kind of elevate and boost your immune system. So one peptide does both. Super safe. We've used it intravenously with patients who come in and have these same complaints. It's kind of a spark, and then you can use it subcutaneously. So that's stands out because we have patients with autoimmune disease who will recommend that peptide, and they do great. I mean, even people with really challenging autoimmune disease, some things like MS and lupus, you can get a lot of kind of immune regulation just with that one peptide. We like to pair it with BPC 157. BPC, very anti-inflammatory. It's known for helping in the gut, like you mentioned, if someone's got leaky gut. Probably the best peptide is BPC, although there's a third one called KPV. I like people will take BPC orally. I've actually found when people inject it sub-Q, it actually affects, in my opinion, the gut better. So you get better results both to the gut when you inject it versus using it orally. And then probably the fourth one on that list is something called GHK copper. And GHK copper kind of grew up in the wound healing world. It's used a lot aesthetically because it helps the skin repair, regenerate really quickly. And that's probably has to do with dropping in copper. Most of us are copper deficient. So it's a great way to get copper into your system. But there's just a very strong anti-inflammatory and immune modulating effect from GHK copper as well.
That's so great. I love the immune ones. And I know several of the peptide combinations that I did with you had BPC in there and TB500, thymosin alpha 1, and they really do help. And, I feel like having those tools, that's having access to something like that, because again, if and when, and that's the thing, like we live in this world, like you are going to get viruses, you are going to get sick, you are going to have stressors in life that maybe suppress your immune system. And sometimes we need, you can take a lot of different supplements and there's astragalus and echinacea and all these different things that can be good. But when your immune system either gets so beat down that it just doesn't have the capacity to regulate viruses and even dormant viruses in your body. Like some people just linger forever and stall out because their immune system just can't seem to manage some of, the old viral load that they've had. And so I have found peptides to be incredibly helpful from that standpoint. I know somebody, because I've actually gotten these questions on Instagram, they're going to say, oh, well then, can I use these on my kids because my kids get sick all the time? And, would that be, something appropriate? So I'll let you answer that because I know that that's something that a lot of families, especially if they're like, oh, well, maybe this can help, my child.
Yeah. So we don't recommend peptides to children less than 18. And while I'm sure they're safe, right, it's just they've never really been tested in any type of capacity. Right.
Yeah.
And so, again, if people get advice otherwise, great. But our kind of official answer is we don't recommend people use peptides if you're less than 18 years old. Yeah. But it brings up a point, like it would be nice if we were able to test them in a way to understand that better for people to use them, right? Because it's, again, great tool. I would postulate whether you're 16 or 10 or 8, you're still going to benefit. Again, these are super safe molecules. Why shouldn't we be able to use them? Well, it's because no one's looking at it, right? And as a result, kids don't get, all the options that we do as adults. That doesn't seem right.
Yeah. Yeah. And that's what I've said too, but I know that question has come up. And so I just wanted to provide clarity there. Now, for our listeners too, because I know that we've talked about, your clinic being here in South Carolina, but you work with people all over the country. You are accessible virtually. So for somebody that's like, okay, well, I would like to be able to have the guidance. I'd like to be able to learn more. What is the process for somebody that doesn't live locally that wants to be able to, do a consult and start utilizing peptides or peptide combinations with you?
Yeah. So we have a couple options. So one, like you said, we can start with a virtual consult. We do have a telemedicine program. We have a physician who is licensed in all 50 states. This is something we just released a couple months ago, where it can stay telemedicine and there'll be guidance that way. Or for people who are looking for more hands-on and really want to kind of dig in, then they come to our office. And so if people come to Charleston, spend some time with us here, and then we get to know them a little bit better, which we always enjoy. And those are for the people who are, they really want to dig into their health, as well as they may want some more hand-holding, some more individualized advice. We can do a lot more things in terms of treatment options when we have that face-to-face with people in person versus the telemedicine, which is really, it's telemedicine. We still like all those people to come because, again, for us, it's about building relationships. Yeah. But the telemedicine and the virtual helps us get started on that path.
Yeah. And maybe even just give us too, because I know we've kind of like pigeonholed into peptides, but your clinic offers so many other therapies too. And your office staff are like the sweetest people ever. I've like emailed with them and they're always like, they're just the greatest. I'm like, I want to come hang out. I'm going to just hang out here. But maybe give people too. Okay, first of all, Charleston's a great place to come visit. So you could just make it a whole vacation. But you've got a number of other therapies that you can't find anywhere else. Like anywhere else, you're doing really cool stuff. So maybe even give people just a taste of, some of the other things that may be good kind of adjuvants of therapy, in addition to even talking to you about peptides.
Yeah, no, I appreciate the question. So we do a lot of in-depth specialty lab testing. We do some different sophisticated IVs. We've done a lot of NAD therapy, probably more so than any place in the world. So we've kind of put ourselves on the map using intravenous NAD to help people, whether they have PTSD, anxiety, depression, or neurodegenerative disease, or a whole host of things. A lot of people will benefit from doing a loading dose of NAD and then a maintenance dose. The loading dose is 5 treatments in 10 days. And then most people do a maintenance dose of 1 IV per month. And there's different variations on that based upon, what the patient is dealing with. But above all, even maybe above peptides, I'm not sure, because people ask me that question all the time. NAD therapy is so strong and people are waking up to it, right? Like people have heard about Dr. Sinclair and using these oral NAD precursors, NR and NMN, and using these different tools. We use methylene blue in a similar capacity. Methylene blue is a mitochondrial enhancer. It's antiviral. We do things like intravenous ozone and vitamin C for all kinds of, ailments, conditions. We use intravenous glutathione. So we have a whole host of things that people can do here that are, like you said, harder to access in other places. And because we have such a long and broad experience using them, we have a lot of experience in how to use them, right? And so part of it is just developing that relationship. What we're interested in is really helping people, on this path, working together and figuring it out together, helping guide them, being accessible, and then using, different tools at the right time to help people reach all of their goals. And it's all possible.
Yep. I love that. And you do some stuff with ozone as well. And there are so many options. And so I think that's such a value because, if you really trying to steer clear of the conventional model, like there are options to help people with chronic disease states, like that do not involve pharmaceuticals and the conventional model. But it is really hard. I mean, I get questions like this all the time because they just don't know. Like, we don't know what we don't know. And this stuff is not, you're not going to be able to Google, natural alternatives to, whatever it is and see like your, clinic pop up or see the therapies that you even offer there. Like, it will be so buried, you'll never find it. I've Ben Greenfield is a friend. He's been on the show several times. I know you know him, have worked with him. Like, so other people like that in this space that are bringing a voice to some of these things that may otherwise be vilified or maybe even like just positioned in a way that promote fear. These things are not, you shouldn't be afraid of them. It's just that we're not educated on them and it's not readily available for most people. It's hard to find. So I love that you're doing work, and you're also training physicians too, right? Like all over the country, you're training other practitioners how to do what you're doing.
We do. That's a part of the practice where we do education, which is really important to me, is helping other physicians kind of learn and use the different tools and compounds that we have experience with so that they can bring that back to their practices, and then help them, right? Because there's so many people, to your point, who are looking for options, but it's hard to find those options. And not to be pessimistic, because I'm an optimist through and through, but the regulatory landscape and the oversight and the pushback specifically that we're seeing from the regulatory bodies is getting stronger and stronger, right? And so I think there's a time and place for pharmaceuticals for sure, but I want people to have as many options that are possible, right? I don't think it's fair for someone to come in and unilaterally say, you can't do this, right? Because the whole foundation, again, if we go back to that Flexner Report, the whole foundation for our lens of health, I think is mostly wrong, right? I think it's, if you talk about heart disease, cancer, all these complicated diseases, it's based on a foundation that just isn't playing out right. If you look from, we spend more money as a country, yet we have one of the worst health outcomes of any country. How is that possible? And I know people will say, well, there's lots of factors. The main factor is we've taken away people's ability to be sovereign in that system and really show up and choose and then want to do better for themselves. We've handicapped and handcuffed people through and through for decades upon decades. And that seems to be getting worse for people. It's going to get worse before it gets better. And so we're committed to really speaking the truth and helping people speak their truth and helping them be their best. And there's just, like you said, there's tons of options. And people come to me all the time. They say, I've tried everything. And I say, you've tried everything that doesn't work. There's actually a million other things for you to try. You just don't know about them.
Yeah.
So.
Oh, that's so good. I love that we landed there because it really just puts it all together. And I love the work that you're doing. I love that you really invest in relationships and educating people, because honestly, until you really start to value your own health enough to really just learn it. I mean, and that's, so true with peptides. Like, every single person is going to respond differently or see maybe more benefit with one over another, but you just have to be willing to get into the process and just do it. Like, you just, and I think, again, like, just the safety aspect of it should give people enough confidence to be like, yeah, that's something that, I can feel good about. And whereas, with drugs, we just assume, well, they're approved, they have to be safe. I mean, there's so many downsides to drugs. It's insane. I mean, we're seeing that all over the place. So I just love so much the voice that you have in this space, that you're really stepping into educating people like us. And Dr. Koniver, where can people find your clinic and your website, your social media? You do a great job really connecting with people and connecting them to resources. So I want to make sure that we'll plug all that in the show notes, but will you remind us where everybody can access you?
Sure. The best place is our website, certainly, which is koniverwellness.com, Koniver wellness.com. And it's the same moniker for, Instagram. It's at Koniver Wellness. No, I appreciate being here and, giving me the forum to have this conversation. It's important. And I love the work you're doing and helping to bring that light to people. And like you said, if someone's not ready to really take interest in their health, a lot of it is because they just don't know what's out there. And so if we can all work together and collaborate, educate people and kind of bring that truth forward, that's what it's all about.
So good. Guys, I mean, Dr. Koniver's the real deal. He's like the peptide guy. And I did not try my first peptide until I went in and met with him and got my peptides from him. And I'm like the biggest peptide advocate now. It's like, it's literally changed my life. I'm not even kidding. I just felt so good. I mean, I still do, but I really feel like I've actually gone through probably the most stressful year of my life, but my health is actually the best that it's ever been, which is like, you would think that, you know, it doesn't make sense. That formula doesn't make sense. But I really tried to dial in the things I had control over. And then I really tried to bring in the best support system for my body. And it worked. Like, it worked. So I've just been so excited for this conversation because I want other people to see the potential there as well and be able to realize that for themselves. So thank you for joining me today. Guys, if you like this episode, share it. Subscribe, listen to it on YouTube. You can find us over at the Health Institute on Instagram. Tag us. We would love to communicate, find out how this information is reaching you and helping you today. Dr. Koniver, such a pleasure to see you. And I hope you have a great day. We'll see you guys in the next episode.